A beautiful smile can brighten your day. Now you can have that smile you've always wanted, and much more. Hello, I'm JW, and I'm here to talk to you about some amazing new breakthroughs in the field of dentistry. If you're suffering from problems associated with missing a single tooth, multiple teeth, or the hassles of loose or ill-fitted dentures, then we have the solution for you. Mini dental implants are an affordable, virtually pain-free, and easy on the patient solution to these problems. This one-day procedure will have you smiling, chewing, and getting your life back to normal again. In a minute, I'll be talking with Dr. Jaime Osorio from Buckner Family Dental, who'll tell us about these incredible dental implants. For over 15 years now, Buckner Family Dental has been offering expert dental and cosmetic care for families all around the Dallas metro area and beyond. Buckner Family Dental is proud to provide the highest quality dentistry using state-of-the-art technology, all in a caring and private setting. Their goal is to have their patients look and feel better with less stress than they may have experienced with older, more conventional methods. When we come back, we'll meet Dr. Osorio, and he'll tell us how mini dental implants are having an astonishing impact on his patients' lives and how they could change yours. We'll be right back.
What you're about to see will amaze you. This man is wearing dentures with no messy pastes, no adhesives whatsoever. The revolutionary 3M denture attachment system. Dentures snap out, they snap in, they stay put. The system is not recommended for everyone, and the required medical procedure carries potential risks. To determine whether this is right for you, set up a free consultation.
For years, I went to my own private dentist and an orthodontist because I had a periodontal disease, and for years, I just kept paying the money out, and my teeth kept getting worse and worse, but there wasn't anything anybody could do about it. But I got fed up with it. I made my appointment 2 to 3 weeks later. They had me in here, and one day I was in with 15 implants and out the same day. And just love it. Tired of not being able to go out and eat. I was very embarrassed to smile. It was always a problem opening your mouth, and who was going to see it? Now I just don't want to shut up, so it keeps rolling out. But I'm so happy with it. But again, I would not recommend this to anybody. Only if you want to have nice teeth and have the best place in the country to have it done, this is the place to come.
Welcome back. Dr. Jaime Osorio of Buckner Family Dental is a graduate of Baylor College of Dentistry. Dr. Osorio is also a member of the Dallas County Dental Society, the Garland Study Club, and the Texas Dental Association. His love of this community and the people that call Dallas home extends to his many other interests, including working as a volunteer with the White Rock JCs and the Shriners Organization to benefit underprivileged children. Having performed so many dental implants over the years, Dr. Osorio has seen firsthand the incredible benefits experienced by his patients. Mini dental implants change lives. It's as simple as that. And now, Dr. Osorio of Buckner Family Dental is here to share and update us on this amazing procedure and how it may be the perfect solution for you if you're suffering from a missing tooth or ill-fitting dentures. Welcome, Dr. Osorio.
Thank you for having me.
Well, let's just get started and just tell me the basics. What is a mini dental implant?
A mini dental implant is a tool to allow you to have a permanent tooth, whether it be a single tooth in the front of your mouth or several teeth in the back of your mouth. It can also be used to make dentures clip on to where you have no use of any more dental adhesives. You can throw them away. So many different examples of how you can use them, but they're just a permanent solution. instead of having removable partials or just removable dentures for that.
What are the different situations that presents itself as far as who you would suggest these for? What situations come up?
Well, if the x-ray reveals that they have bone loss, if the teeth are periodontally involved, which means just gum disease, periodontal disease in general, and it's better just to get all the teeth out to stop the bone loss, because the more you have teeth that are infected, bone infected, the more bone you're going to lose over time. So we have to make that decision with the patient. So if you keep your bone more, if you keep your teeth more or longer, you're liable to lose more bone. It shrinks. So let's take action now. Get the teeth out, get you some implants, stop that bone recession, put these in, snap them in.
Is there a certain age that you see that bone recession, or is it kind of across the board?
It's across the board. It depends on family genetics. I've taken full teeth out on a 28-year-old before, because they were genetically just predispositioned to have bone loss, and it was nothing they were doing wrong. So it just depends. But mostly we do 50 to 60-year-old patients, but we have done these in young people as well.
Tell me a story or two of some of the particular patients that really, I'm sure it just has to change their lives.
Well, I tell you what, there's a guy that services my air conditioning. He was always embarrassed to smile, and I said, look, come over to my office, let's see what we can do for you. And it took him 3 years, but he finally came over to my office, and you should see him now. He just smiles with confidence. He has a Hollywood smile, and he has dentures, and nobody knows that he has dentures. And they're implant dentures, just like these.
Yeah. How long is the procedure?
Usually about an hour and a half.
So there are follow-up appointments as well?
Next day post-ops, yes.
You've got to have out-of-town patients. I would think it would be a wonderful benefit to those folks that aren't right in the Dallas market.
Yeah, we've had several people come around town, truck drivers that need to be in Florida or Tennessee the next day, and they say, well, I want to get this done. I'm tired of having these loose teeth. I want to smile again, and we present this treatment to them, and they accept it, and we do it that day. So it's pretty nice to be able to treat somebody that day and change their life the same day.
So this procedure is new. 5-10 years ago, was there no option?
It's relatively new. It's been around for a few years. It's grown in popularity in the recent years. There used to be no option. It used to be just traditional implants, which costs a lot of money. But now we have this option that's more affordable than traditional implants, and better than just getting a denture that you have to use a bunch of glue or adhesive for. So
We'll be right back.
I was kind of scared because I don't like shots. Nothing hurt. And she put my teeth in, and I was like, wow. So I was really excited when we came back up for the checkup. I'm like, okay, I know it's only been 2 weeks, but let's schedule the uppers too. And now I can open my mouth and eat, and I can eat steak. So I'm happy. After the second set got done, I went to my daughter's house and she started bawling. She's like, Mama, you look like yourself again. You look like my mama. And that was worth everything to me. I love these people. You walk in, you feel like they're your family. They genuinely care about you. They listen to everything you say. They do it right the first time. You'll walk out with no regrets. Don't let somebody else tell you they can do it. Research it well.
What you're about to see will amaze you. This man is wearing dentures with no messy pastes, no adhesives whatsoever. The revolutionary 3M denture attachment system. Dentures snap out, they snap in, they stay put. The system is not recommended for everyone, and the required medical procedure carries potential risks. To determine whether this is right for you, set up a free consultation.
Welcome back. Share with me some of the stories that you hear from patients who didn't think there was an answer.
Well, I had this lady come the other day that had been to 6 or 7 consults in the last 5 to 10 years, and was presented with traditional implant options that were way out of the budget. And so all she had available to her was traditional dentures, which involve the sticky adhesive that nobody likes to use. So we had a consult with her and showed her how the mini implants work. Her old denture covered the palate and gagged her, and she hated that.
Yes.
She couldn't taste her food like she used to with that for 10 years. Her speech was affected because the tongue was hitting that palate. And we showed her a simple example of our mini implant denture and how we horseshoe or U-shape this denture, and it sticks. She wears it at night. She tastes her food the same. She sleeps with it, and she was just amazed. Said nobody ever took the time to explain that to me. Thank you. And so it's changed her life.
Absolutely.
And that simple explanation prompted her to accept our treatment. And now she says, why did I wait so long? I also had an example of a lady that was always, she'd come into my office on several occasions, even before the mini implants, and was covering her mouth because she was embarrassed about showing her teeth. And she was shy away from looking at me in the eye. And I asked her, I said, what's going on? Is there something you want to improve? And she says, well, I kind of have a gap back here that you can see. Even though I have my front teeth, there's a little gap back here that I'm missing a tooth, and my teeth kind of shifted a little bit. But you know, I really want to get that fixed, but I don't want to do a traditional bridge where I shave the adjacent teeth. I want to get something permanent that doesn't destroy the other teeth at all. And we offered her a mini implant, and you can see her confidence now. It's night and day. She smiles more. She's more confident at work. Her friends have even noticed that she's more social now. So we changed lives.
Yeah, to have such a life-changing procedure and for it to be so affordable. Yeah, that's huge. Is it uncomfortable?
Well, like with any dental procedure, you're going to feel some type of uncomfortableness. But compared to an ill-fitting denture that keeps scraping the side of your gums, a single tooth missing that you can't, socialize because you're embarrassed to, I mean, what's the comparison here? I mean, a little discomfort to get the reward at the end, which is confidence.
Absolutely. What do you offer to make me more comfortable?
Well, we offer IV sedation, which means putting you to sleep. Most of our patients that request being put to sleep, they wake up brand new teeth that adhere to their implants. And if you don't want to be put to sleep, there's patients that just don't believe in being put to sleep completely. We do offer oral sedation, which doesn't put you completely to sleep. And also we have nitrous oxide, which we don't charge for. We give for free, and that's laughing gas.
Well, now let's talk about recovery time. Tell me what happens during that time.
It depends on the person. The people with better, overall attitudes about their healing they're gonna heal faster, but more than likely 3 to 4 days of healing time.
Okay.
And we offer appointments to adjust the denture. They give us a call. We schedule an appointment. We get them in right away until they feel better. And there is an adjustment phase, just like with anything. But we're here for them all week long.
So I've made that call, and I'm coming to Buckner Family Dental for my first time. What am I going to experience?
From the moment that you walk in the door, you get greeted by our friendly team, and one of my assistants takes you in the back and shows you our office. You get put in your own personal room with the TV until I get in there.
So I will see you.
You will see me.
Okay.
And we go over your x-rays. I show them how the mini implants are placed into the bone, and then the result you get after the denture is placed in there. And whether they want to do it the same day or wait a couple of weeks, it's up to them.
Okay.
And whether they want to get put under anesthesia or just conscious sedation.
So you have quick appointment times.
Yes.
So if I don't want to do it that day that I'm there, but I want to come back, you're not going to say, okay, in 4 months?
No, usually if the person doesn't want to do something that day, it's usually because they have to ask off from work. A lot of our patients want to do it on a Thursday or Friday because they have the weekend to recover. So we try to be accommodating.
Sure. And you require a driver for their safety?
Driver for their safety. For those people that just want a little bit of sedation but they want to drive, we do the nitrous oxide, which is it leaves your body as soon as you're off the gas, so it doesn't affect your driving at all. But we have a lot of things we offer that will make the experience comfortable for them.
What you're about to see will amaze you. This man is wearing dentures with no messy pastes, no adhesives whatsoever. The revolutionary 3M denture attachment system. Dentures snap out, they snap in, they stay put. The system is not recommended for everyone, and the required medical procedure carries potential risks. To determine whether this is right for you, set up a free consultation.
I had good dentures, they were good, my mouth was the right shape for it, they fit well, but it just couldn't eat anything. I couldn't chew an apple, I couldn't bite a pickle, nothing was very white, I couldn't chomp down on it, it would flip up. All the adhesives in the world didn't help. You know, I used to have to slice apples and slice pickles, and now I can get a Clausen kosher dill and just eat the whole thing just by chewing on it. Well, you're friendly, everybody knows you. I walk in the door and they say, "Hi Bob, we got an appointment today?" And it's like they've known me all my life. So it's a good place, it really is.
Welcome back. Well, I've had my consultation and I'm ready. I want to do the procedure. So explain to me what's going to happen when I come back for that.
If you, let's say you wanted to get it done today, we would take impressions today. We would, it may have you stay the whole day though, because when we do take impressions, we have to get your bite right, so we may have to get some more measurements along the way while your denture is being made. Then later that afternoon, your denture would be ready to be put in your mouth, already processed. So we would put you on anesthesia, whether you wanted to do nitrous with IV sedation, which means putting you to sleep, conscious sedation, which is just a pill that you would need a driver for, both of those procedures. We would get you sedated for that. We would do what we needed to do, depending on, just replacing one tooth. We would extract that tooth. We can immediately place the implant, take an impression for the crown, and have the crown ready for you right after that procedure. So that's an easy one. If you were looking for dentures, we would extract all the teeth, place the implants between the sockets where we pull the teeth, and then immediately load your denture or snap it into place, and you would go home with teeth. Either way, whether you did a single tooth, a 3 teeth or full teeth, we could have you ready that afternoon to go home with permanent teeth.
And how long is this procedure?
It can vary. If it's a single tooth, my working time may be just 20 minutes. If it's a full mouth case, it could last anywhere from an hour and a half to 2 hours.
And so if I have a driver waiting for me in your waiting room, do you give them reports? Do you let them know how things are going or how much time is left?
I go myself to talk to the patient's family or loved one and let them know how things are going periodically, while the assistants are taking x-rays in between, and my placement of the implants. I have them take x-rays to see where we're at, how we're doing, and I go and check on the family members and let them know what's going on.
Are there patients that this isn't the answer?
Yes, there are some patients that don't qualify to be implant patients because of their bone level, but you won't know until you come in for our complimentary consultation, and we find out by x-rays and looking at the bone and really seeing if you're a candidate or not. But more than likely, we'll make it work somehow. If we can't do that, we'll team up somehow to either bone grafting, or there's other solutions, team solutions to get you going. So.
And Buckner Family Dentistry, you guys are, you have all kinds of services. You're not just a mini dental implant office.
Exactly. We do everything from root canals, extractions, crowns, cosmetic work. So we do all the services. We do orthodontics as well.
Well, can you just tell us a little bit more about Buckner Family Dental?
I've been in practice. I've owned the office for 12 years now, since 2003. We have done, like I said, a variety of dental treatment throughout the years. We specialize in general dentistry. We do it all.
So is there an overall philosophy that you have when it comes to treating your patients?
Yeah, the overall philosophy is to treat them like a family member. Give your patient options. You know, if you're limited to one thing and you can't be flexible, I think that drives patients away. They don't like to be delegated to another dentist. We want to keep it in house. So we were like, if I can't do it myself, I'll find somebody that to do it. But
They depend on that,
yeah. So give them options. Not everybody's a candidate for implants, but I can do something else for you.
That's right. Well, as we wrap this up, is there a final thought that you'd like to share with us as well?
Yes, that you don't have to live with the uncomfortableness, just the day-to-day frustration of having regular dentures or missing teeth for that matter, not just dentures, and being afraid of going out in the public and being confident. Confidence is just a call away, and we can help you with that. We can make a difference.
Having dentures never felt like they were a part of me, nor did they ever feel like they were very natural. Not being able to eat everything I wanted to eat, nuts, chew things that were hard, those were the things that were very difficult when you have dentures. They all tell you, oh, it doesn't hurt, but don't ever believe them. But when I had the mini dental implants, it really didn't hurt. I was surprised at that. Actually, the cost in retrospect, I would have paid double for how much good it has done me. It was 2 hours from start to finish. After they numbed me, of course the pain is gone at that point, and I had 6 implants put in like 2 hours. And after the implants were put in, I actually drove myself home and only used over-the-counter medication for what little discomfort that I had. When you sit down to eat in a restaurant, you think, oh, I can't eat that or that, and then one day you think, I can now. This is wonderful. Now I can eat these things and feel more at ease and not have the floating dentures and don't have to get up to go clean your teeth in the restaurant. They just feel like they're a part of me now. And so you just feel more confident.
What you're about to see will amaze you. This man is wearing dentures with no messy pastes, no adhesives whatsoever. The revolutionary 3M denture attachment system. Dentures snap out, they snap in, they stay put. The system is not recommended for everyone, and the required medical procedure carries potential risks. To determine whether this is right for you, set up a free consultation.
Welcome back. We've learned a lot already from Dr. Osorio about the benefits of mini dental implants. But maybe you're thinking, hey, that's for movie stars and millionaires, not me. Well, I've got great news for you. We're joined now by Craig Allen, office manager at Buckner Family Dental in Dallas. Craig helps patients at Buckner Family Dental get the quality dental care they need, including mini dental implants, using plans they can afford. Hi, Craig. Welcome. Thanks for joining us today.
Absolutely.
Dr. Osorio's work has just been life-changing. And I'm just wondering if you can recall any patient stories that has had an impact on you and your team.
Absolutely. One does come to mind. I had a patient who was completely debilitated by an accident, and during that time lost all of her teeth. So when she came to see us, the story was she would never be able to wear dentures, she would never be able to get implants, and with the technology of the mini dental implant, we were able to secure her dentures, and she's wearing them now. The day after, she had a steak.
Oh my goodness, that's amazing.
It really is.
It really is. So what kind of things do you hear from your patients after they've gotten their mini dental implants?
That they waited too long. They were wearing flippers, they were wearing some type of partial removable appliances. It was embarrassing, it was tough. I had a young lady who came in. She was wearing a flipper, and she was having to take this in and out to possibly eat, to go to bed, and she was such a young, beautiful woman. We were able to do some mini implants for her and restore 2 missing teeth. She has the smile that she's always wanted now.
One of the big questions on a patient's mind when they come in is the cost. You know, how much is this going to cost me? How do they get those questions answered, and where does that happen?
When people come into the practice, they think automatically, this is going to be so expensive.
Yes.
I don't know if I can afford it.
Yes.
And when we bring you back to a private area where you will meet me, we talk about those finances and we break down how we can make it affordable. You're in a private setting. It's comfortable. We don't want it to be uncomfortable.
So is this covered by insurance?
It's a great question. It's one of the things that keeps people from doing procedures like this or general procedures. So we do offer cash, check charge discounts with no dental insurance. If you do have dental insurance, as long as it's a PPO, we accept it. If not, then we have opportunities where you can sign up for dental insurance. I just had an opportunity where a patient who we've taken care of has an insurance company that provides dental insurance for our patients specifically. It's a great deal. And they can use that insurance within a week.
Amazing. That is great to know. So tell me more about Buckner Family Dental.
Buckner Family Dental, with Dr. Osorio's vision and my vision together, we really wanted something that was going to be comfortable for not just our team members, but for our patients. And so we have a really, really fun atmosphere, a family atmosphere. When people say we're a family practice, we really mean it. We serve our clients, whether that be in the community, giving rides to pick up or drive home. We also serve in some of their activities at their churches. We get involved. We're a true family practice.
So Craig, as we wrap things up here, do you have a final thought that you'd like to leave our viewers with?
That it can be affordable, that they can make that change in their life. We know that it's possible. They just don't know it yet. But we can. We can make that change, make it affordable. They just need to call.
Thanks so much, Craig. It's great to know that Buckner Family Dental has so many options to make mini dental implants and all types of quality dentistry available to so many. We'll be right back.
What you're about to see will amaze you. This man is wearing dentures with no messy pastes, no adhesives whatsoever. The revolutionary 3M denture attachment system. Dentures snap out, they snap in, they stay put. The system is not recommended for everyone, and the required medical procedure carries potential risks. To determine whether this is right for you, set up a free consultation.
Welcome back. If you or a family member or friend is suffering from a missing tooth or multiple teeth or ill-fitting dentures, you really should call Buckner Family Dental. They always offer a free consultation, so call the toll-free number on your screen now. Dental implants can make life so much easier by helping you eat, talk, and smile better. And as you've heard today, Buckner Family Dental can make mini dental implants easy, comfortable, and affordable. We'd like to thank Dr. Jaime Osorio and Craig Allen of Buckner Family Dental in Dallas for joining us today. This has truly been valuable information about the exciting advancements in the world of dentistry and dental implants. We also hope that you will call the toll-free number right now to take advantage of the no-cost examination to see if dental implants are right for you. Of course, Buckner Family Dental is a lot more than just implants. For your general dentistry needs, Buckner Family Dental should be your choice for the entire family. They offer emergency appointments, quick appointment times, and they're open on Fridays for your convenience. Financing is available and they accept credit cards. All that being said, it's the personalized care that makes Buckner Family Dental the perfect dental clinic for anyone in your family. If you'd like to find out more or share this information with a friend or family member, please feel free to visit bucknerfamilydental.com. Thanks for joining us today. I'm JW, and we'll see you next time.